Together we achieve victory over heart failure.
Hi, I am Dr. Sharath Babu, practicing interventional cardiologist at Mysore. Today, I just wanted to discuss about few valuable points regarding heart failure. So, what is heart failure? People think heart failure means it is something failing in your body and it is the end of life. No, that is completely wrong. You have to understand heart failure still has scope of treatment, and you must understand what exactly heart failure. Heart failure is the inability to pump exactly what the heart has to do during its whole lifetime. So it is the reduction in its function and capacity. So that is heart failure. In that, we usually take pumping fraction of the heart. So how much blood receives the heart, it pumps that much percentage. So the exact percentage what is told to be normal is more than 55%. So if it is reducing below 55, it is called mild. And depending on the different number, we categorize into mild, moderate, and severe. And the treatment part also differs accordingly. So coming to next, in Indian scenario, what exactly? So nowadays the heart failure cases are increasing, and the majority of the reason being genetically determined. So some are due to heart attacks following which patient heart fails, and the rest of the things are mainly due to genetic. There are multiple causes. So even if we find out etiologies, the management in 90% of the cases will be the same. So apart from this, comorbidities like diabetes, kidney disease, hypertension, these all contribute to the worsening or the initiation of the heart failure. So coming to third point, what are symptoms and signs? Patient usually recognizes fatigability, breathlessness, or giddiness whenever the BP falls, whenever the heart is unable to function. So it might show in the patient as a palpitation, the feeling of heartbeat, or sometimes even angina, like chest pain also can come in the case of heart failure. So these things patient has to be aware of. And coming to signs, patient may notice his developing swelling on the lower limbs, or there is distension of the abdomen, or puffiness of face. So, and increase in his heart rate, these things, and increase in his weight gain due to puffiness. So these things, when he notices, he should come into physician or cardiologist consultation. So after these three main insights, I'll come to how to protect against the heart failure. Mainly, it is early detection of the symptoms and signs, and patient himself or herself has an important role in identification. Then the rest of the diagnosis will be in the part of the cardiologist. So apart from early detection, and diet has a main role, there will be diet restriction in patients of heart failure, like salt restriction, and then exercise. So exercise tolerance should be gradually trained up, and stress management skills has to be taken care of, and quit alcohol and smoking, which are main contributory to the progression of these heart failure symptoms. So coming finally, treatment. So what all treatment options? There are different for different categories or different stages of heart failure. We have different medications. Apart from medications, there are multiple devices which can help improve the heart functions. And finally, when everything fails or patient is not responding well, so transplant, cardiac transplant might be the final option. So finally, to conclude, every man or woman will have 1 in 5 risk of lifetime developing heart failure. And concluding, I want to give awareness of these 5 insights regarding heart failure. Thank you very much.